this is the important one. So this is why we do digital case planning, so we don't get that. So the transition line is the key planning aspect that you need to think about. And all that is where does the restoration start and where does their tissue start? You don't want to see that. That's a bad day. So you've got to plan these cases out. And we're building on all the stuff we talked about, the full arch photos, the exaggerated smiles. You're taking these photos, and when you're planning these cases, you're looking at the photos and you're envisioning where is their transition line going to end up? Where is their high exaggerated smile lip line? And let's make sure that those two are working together, that you're hiding that transition line. A gummy smile. You're going to have to think twice, like, hey, how should I restore this case? Is it appropriate to restore this case with a hybrid? Because you just don't want to show that line. That's going to be a really bad day. And how do you revert from that? It's really tough. So the transition line, we call it the case killer. So you don't end up with this. I mean, that's just ugly. So, remember, the exaggerated smile is really important. Maybe there's the normal smile, but then, they want to laugh with these things. They're going to get teeth. They want to be happy and confident and laughing. So that's the exaggerated smile. That's what we want to know. Where is their lip line when we're planning these cases? So let's say they show a lot and they're a gummy smile. What are our options? So, you could just do an FP1 where you are just not going to reduce their bone and you're just going to build teeth. And in FP1, that transition line is just white teeth up against their pink gum. But, remember, we talked about, recreating papilla naturally is really, really tough. So a high cosmetic expectation case, you got to just think about these things. Because you don't want them to be like, why does my teeth just look so flat across the gum line? Why does it look like I have long horse teeth? So you want to, think about these things and think about your patient, what their expectations are. Second option is we could reduce the bone. So you could case plan it. You have your photo up and you're case planning. You think, how am I going to get the bone up so that the transition line is above this gum line here? You can plan the bone reduction into that so that you raise that transition line up above. And then you're looking at, okay, if I were to reduce the bone there, do I still have enough bone apically to that reduced position where I can support the implants that I need to support? If you can, then great. Maybe bone reduction is the right option. And then obviously, there's always the overdenture. But overdenture, you guys have done dentures and overdentures. I mean, there's still a restorative space aspect in overdentures that you have to consider too. Building an overdenture on this guy might not be hard, but sometimes it's hard because maybe the teeth really need to be up here. And that's where his ridge is. So you guys have all seen, dentures that have a really thin tooth right over the denture because the ridge is right behind that tooth. Then you get a thin tooth that's thinly bonded and, teeth pop off. So you want to think about, even with your overdentures, restorative space, make sure that there is some.